There's no question in my mind that some vaccines are beneficial, but we've always just accepted that they're beneficial without really doing any trial data. So it's not really evidence-based. And when the question marks with the COVID vaccines came along, we started questioning other vaccines. And I've talked to people that, again, have been vaccine advocates all their life, and they say, you know what, now I really don't know whether all these vaccines are good or not.
So there's the Henry Ford study. They finally did a study that compared unvaccinated children with vaccinated children, and they did a big study, and it was by doctors and researchers that were pro-vaccine. They wanted to actually do a study that shut up the anti-vax people or the vaccine skeptics, and to show that there was no health detriment to vaccinating children. So they did this study, and well, here's Aaron Siri, who's the biggest lawyer who covers this kind of stuff and sues for vaccine injuries. He just gave testimony to Congress, and I just want to play this for you and get your reaction. Go ahead.
Is this all vaccines or just mRNA vaccines?
No, these are all vaccines.
All vaccines, yeah.
Yeah, so here we go.
The study began by explaining it set out to reduce vaccine hesitancy by assuring parents the CDC vaccine schedule is safe.
So they set out, when they did this study, to reduce vaccine hesitancy, to assure everybody that vaccines are safe. But
which, of course, is the opposite of science.
Yes.
In science, you don't say, you know what, I think I'll go and prove that the Earth is round. No, you go out and see, well, what shape is the Earth?
Yes.
You don't go out and prove something. You go out with an open mind. The answer could be yes, or the answer could be no. The idea that you do a study, why don't I do a study to prove, I don't know, prove that alcohol is good for you? And you probably could,
Yes.
It's just not the way science should work, but we'll accept that that's what they did.
Okay, so here he goes.
Yeah.
Instead, what these researchers found was that vaccinated children had 4.29 times the rate of asthma, 3.03 times the rate of atopic disease, 5.96 times the rate of autoimmune disease, and 5.53 times the rate of neurodevelopmental disorders, which included 3.28 times the rate of developmental delay and 4.47 times the rate of speech disorder. All of these findings were statistically significant. There was also other conditions for which there were numerous cases in the vaccinated group, but zero in the unvaccinated group. Hence, a rate cannot be calculated, including brain dysfunction, ADHD, learning disabilities, intellectual disabilities, and tics. For example, there were 262 cases of ADHD in the vaccinated group, and there were none in the unvaccinated group.
So he's saying that there were no brain disorders in the unvaccinated group, but there were lots of, over 200 in the vaccinated group, like with ADHD, things like that.
Wow.
Studied
around
16,000 kids in the vaccinated group, by the way, and around 2,000 in the unvaccinated group. So the rate, of course, between those is important, and that's what the study compared. These findings were troubling, including because these chronic health issues can be caused by immune system dysregulation, and vaccines can cause immune system dysregulation. Citations for this are in my written submission. Overall, the study found that after 10 years, 17% of the unvaccinated children had a chronic health issue, while 57% of the vaccinated children had at least one chronic health issue, often multiple.
So unvaccinated kids had 17% of them had a chronic health issue. The vaccinated group, 57% had a chronic health issue. Okay.
17 versus 57%. The only real problem with this study and why it didn't get submitted for publication is that its findings did not fit the belief and the policy that vaccines are safe. Had it found vaccinated children were healthier, it no doubt would have been published immediately. But because it found the opposite, it was shoved in a drawer. We have repeatedly urged Dr. Zervos and Lamouretta to submit the study for publication. They have affirmed the study was well designed and conducted. But Dr. Zervos has said he doesn't want to lose his job. And Dr. Lamouretta has said she does not want to make doctors uncomfortable. This is a real-world example of how the science around vaccines gets corrupted. How only studies that confirm the beliefs and policies that vaccines are safe get published. Everything else gets shoved in a drawer. This selection bias is dangerous and results in corrupting all the science concerning vaccine safety. We can protect children from infectious disease, and we can protect children from vaccine harms. We should and we must do both.
So I'd like to get your response to that they actually did do a study. It was done by a pro-vaccine institution with pro-vaccine doctors trying to prove that vaccines were good for you, and the conclusions were the opposite. They were obvious. There was broad and stark differences, and then they never published that paper because it didn't fit the narrative, because they were afraid they would lose their job because of the financial corruption involved in the medical system. Go ahead, you take it wherever you'd like.
Yeah, I mean, it doesn't surprise me at all, but completely appalling. When was this study done, Jimmy? I haven't heard of it.
Oh, really? I thought. Oh, okay.
No,
I thought you'd be the guy. I went to your channel. I didn't see you had talked about it, but I thought you.
When did it come out?
It didn't come out.
That's probably why.
Yeah,
yeah,
it got suppressed.
It's probably been hushed up.
It got suppressed, and I guess he found it somehow. And
I wonder when the actual research was carried out.
I think it was not that long ago, because I know Del Bigtree had talked to the guy who kind of talked the guy into doing the study, and he had the doctor who did the study promise that no matter what the results, they would publish. And he said, yes, of course. And of course they didn't publish. So that's got to be recent. I don't know. I'm going to guess in the last 5 years or so.
I'll certainly look into that and try and find out. I've got people that will probably know about that. I mean, the fact that adverse
20. Oh, it's 20. I'm sorry. My producer just told me that study came out in 2020.
Oh, right. Okay. Oh, right. Okay. 2020. Interesting. So, yeah, just a few years ago. Interesting. Right. The fact that adverse results aren't published is absolutely appalling, isn't it? And the antithesis of science. It's exactly what we shouldn't be doing. And yet it doesn't surprise me at all because of the vested interests that are involved. I've actually been an advocate for general vaccination all my life. And I still think that it's very likely that quite a few vaccines are going to be useful. I mean, tetanus, for example. I've seen people with tetanus. I've seen a baby with tetanus. It's pretty horrible. So there's no question in my mind that some vaccines are beneficial. But we've always just accepted that they're beneficial without really doing any trial data. So it's not really evidence-based. And when the question marks with the COVID vaccines came along, we started questioning other vaccines. And I've talked to people that, again, have been vaccine advocates all their life, and they say, you know what, now I really don't know whether all these vaccines are good or not, because it's actually very complicated. So suppose you take measles. There's been a lot of fuss about measles lately, that anti-vaxxers are stopping people getting measles. Well, if you give measles vaccine, then children after that will get less measles. That is true. But that's not telling you about overall outcomes, though the fact that you get less of one disease doesn't tell you anything about overall health. So if, and I don't know, but if measles vaccine, for example, it's probably a bad example because I think measles vaccine is probably a good idea. But if a particular vaccine prevents a particular disease, then the outcome that we're looking for really should not be that particular disease. It's the entire health of the individual. And we're talking about there from that 57%, they said, with children with a chronic disease condition. So which would you prefer, to take the risk of getting one particular disease and get one particular illness and get natural immunity that might have, I don't know, say a 0.5% of having some nasty outcome, or 50% chance of having a chronic disease forever? So we're looking at the wrong outcomes. We're looking at far too specific an outcome. So a particular vaccine is going to reduce a particular disease. Yeah, for sure. I don't see any problem with that. But what about overall health outcomes is the thing we have to be looking at. And particularly in the States, when so many vaccines are given, you're giving lots of vaccines all at the same time.
Yes.
That's got to have interactive effects.
Yes.
You know, whenever possible in healthcare, you want one variable at a time. So you know, people will start taking a particular drug for a particular condition. And then if that has an effect, you know that it's the drug that was beneficial because you're dealing with one variable. But if you give 6 drugs at the same time, then which drug was it that's improved the condition? Well, you don't know because you've got too many variables. So we really need to kind of cut that down, looking at, you know, just what's happening here. What are the outcomes? And that's such an obvious one. Protecting against one disease. What about all the other ones? What about the overall effect on health? What about the interactions? But the immune dysregulation, if you're clobbering the immune system over and over again, let me give just one simple example. Whenever you have an infection or whenever you have a vaccine, that's going to stimulate an immune response. That's going to have, vaccine is going to stimulate an immune response. Now, that immune response can be beneficial or it can be harmful, but it's always going to be immune response, and that's always going to use up vitamin D. So when you have a vaccine, it's going to use up some vitamin D. Another vaccine is going to use up some more vitamin D. But because we don't supplement vitamin D and we don't really think it's important, that means if people are given multiple vaccines, they're going to become deficient in vitamin D, which is going to affect their immune system. And we've already said that the immune system is essential for protecting us against cancer, which is another disease outcome. And that's just one example. So given multiple foreign antigens, especially all at the same time, like you do in vaccines, what are the interactive effects of that? If you give one and you have one adverse effect, you've got one variable, but we're giving a dozen of them. How can we possibly say which one is giving rise to which variable? Of course, that's what our clinical trial does. It has one variable at a time, a specific intervention for a specific outcome, but you're giving so many. We don't know. I mean, it seems to me what's happened with the vaccination program in the States is a topsy curve. We call it a topsy curve. So you have one brick and another one on top, and that's fine. That sits on top of it. But then when you put on another one and another one and another one, it starts veering away from what you originally thought. You might end up half a mile away from where you originally thought you were. What we need to do is go back and compare with a placebo, with something we know to be inert. So, it's like saying, is alcohol bad for you? Well, let's give someone half a pint of whiskey a day, and the other group, let's give them half a pint of water a day. And then you find out that the half a pint of whiskey a day is probably not good for you. But we're often not doing that. We're saying, I want to know, is alcohol bad for you? Let me think of a study. Oh, I know. Why don't we give someone half a pint of bourbon and the other half, the control group, half a pint of Scotch whiskey, and see what the difference is? It's ridiculous. And that's what we're doing. We're comparing a treatment with a medical treatment or a vaccine with another vaccine rather than nothing, something that's inert. So we need to go back to these fundamental principles. So, you're asking me about childhood vaccines. Basically, the evidence you've got there is pretty convincing. I suspect that they are protected from the particular disease, but what is the overall outcome? How should we be going forward with this? Well, we should be striving for evidence-based medicine. That's how we should be going forward. We should be striving for medicine. I'm certainly going to look that up if we can find that data. That's pretty devastating. We'll splash that around everywhere. But the conditions that you mentioned there, the asthma, that's very often allergic-based, immune-based disease. It's inflammation of the airways, very often immune-based. Atopic conditions, atopy means a predisposition to produce immunoglobulin type E's, I think it is, when you're not supposed to produce them. But atopy means you can just be develop immunity to different things in terms of allergy rather than immunity. All the neurodevelopmental conditions, I mean, these are pretty frightening because a lot of those perhaps won't get better because, as we've said, nerve cells can't reproduce themselves in the adult state. So there's things there that are really quite concerning. Quite a few of them have immune dysregulation, possible causes, possible etiologies. And if you're giving lots of things at the same time, that's just not what the immune system's designed to do. We're good at fighting one thing at a time, occasionally two. In a natural situation, you might get one disease and another one superimposed. But, the idea that you get a dozen at the same time, like kids get exposed to all these different vaccines, the interactive effects, I would say, are impossible to predict because it becomes a chaotic system. It's like the weather. The butterfly flaps its wings and, you get a thunderstorm in Texas or something, because you're giving so many variables all at the same time. I think it's impossible to predict the outcomes. I don't think you can do a study on a dozen variables at the same time. Therefore, if you don't know, you should always err on the side of caution in medicine. First, do no harm. Don't fiddle with things you don't understand, doctors. And fiddle with things you do understand. And
so they try to pretend that they have tested these vaccines against a placebo, but they haven't been. In fact, when they test these vaccines, these childhood vaccines, they, like you say, they test them not one at a time. I mean, they test them one at a time, not as they actually give them. They'll give them in like groups of 3 or groups of 4. Or, within a couple months, they'll give you 6, 7 vaccines, and they've never tested, they've never done a test for that. And that's what RFK wants to do. And of course, they have to paint him as the devil so they could stop that. And people, again, just go along with it. People who call themselves liberals go right along with it without questioning the science because they've turned science into religion.
Yeah, and there are other ways it could be done short of randomized double-blind controlled trials. You can do epidemiological studies. So the Amish, for example.
Yeah.
I'm pretty sure I'm thinking they don't have any vaccines at all.
Right.
And they seem to do fine. What you could do is, you could have groups of people around the country where you give them less vaccines or, different combinations or, you don't need to compare it with nothing. There's many ways this could be done. We've got lots of brilliant epidemiologists and statisticians, and they can dream up ways to do this and analyze this data in ways we couldn't possibly imagine as non-specialists. This could be done. In my view, it should be done, but mostly it's not being done. And there's so many ways we can research these topics, but the will has got to be there to do it.
So they did do a study of Bill Gates's vaccination program in Africa. And they found out that the things that they would be vaccinated for, they didn't get the disease, but those people who were vaccinated went on to die sooner. They had overall a higher morbidity than the people who didn't receive those vaccines. So yes, what you were saying earlier, that if you get a vaccine, it can give you immunity to a certain disease, but does it make you have other diseases? Does it screw up your immune system so you now develop other diseases? And it seems like there's a correlation between that, because the studies seem to show that the unvaccinated people had a greater longevity, and the people who were vaccinated, while they didn't get the disease they were vaccinated for, they died earlier and had higher morbidity overall. And so that they don't ever want to talk to you about that. That's what you were talking about, right?
Yeah, I don't mind too much getting a particular disease. What I want is a healthy life. And
right.
For our kids and grandkids, if they get kids always get infections, that's kind of okay. I mean, some infections are dangerous. I'm not belittling that. But what we want for our kids is to be healthy overall. And multiple variables, looking at just one simple variable, saying they didn't get that particular infection for that particular period of time, is simplistic. We need research that's a bit more sophisticated than that. And at the moment, I don't think we're getting it. And it's reassuring that study's come out, and it's reassuring that RFK is asking fundamental questions. Very often we don't ask questions that are fundamental enough. We try and be clever. We say, well, what about if you tweak that little bit or that little bit there? Whereas I say, well, why don't you get rid of the whole lot and see what you like, being absolutely fine, why don't you stop eating for a few days and see what happens? Why don't you try something that's completely a bit more fundamental? We tend to ask clever clogs questions rather than fundamental questions. And these simple, almost childlike questions are very often the ones that give us the most profound answers.
Come see me on tour. I'll be in Sacramento, San Francisco, Irvine, California, Sydney, Melbourne, and Brisbane, Australia, and then Burbank, California, the day after Thanksgiving. Go to jimmydore.com for a link for tickets.